Now I just want to go over SLD, simple lymphatic drainage, for the right breast area. So start off, this can be done in lying, it can be done in standing, sitting, but you need to have skin to skin contact. So people often do it in bed, in the shower, wherever it suits them. Generally people do it with their hands on their skin, but if that's not something that feels comfortable to you, you could use a long handled sponge or a body brush or something like that, just something that you can put light pressure on your body. We start off with some deep breathing exercises. So taking 4 or 5 deep breaths, feeling your tummy expand on the inhale and your tummy soften on the exhale. Once you've done 4 or 5 of them, then you're bringing your fingertips just up to behind your ears. And you're just doing some small circles, pulling the skin gently downwards as you slide your fingers down your neck. Working your way down towards this little notch just above your collarbone. Repeating this 4 or 5 times, sliding down. You want this whole sequence to take about 10 minutes. So sliding down your neck there. And then you take your fingers, and it's easiest to do it across your chest, into the top and the bottom of your collarbone, just there. And then you're just sliding your fingers closer together. Just come a little closer so you can see here, sliding them towards the centre of your body there. You might want to just give a little press with the index fingers just above the collarbone, and then continuing that slide and pressing movement. Good. And then we're using this parked car analogy. So the right breast is the one that's swollen or congested in this case. So the traffic light is over here under the left armpit, and we need to move the cars across through the light once we've turned it green. So we're going to take the palm of the hand with the index finger into the armpit, and you can press slightly more firmly here. A slight scooping, pushing up action into the armpit. Doing that 4 or 5 times, and then bringing the flat of your hand across your body, and you imagine you're moving this car through the traffic light. It's quite a light pressure. You want to feel the skin being slightly pulled and wrinkled as you're sliding over, but not pressing too hard. Once you've done 4 or 5 here, you come back and you're essentially just pushing up into the armpit again, as if you were trying to keep that light green, stopping it going red. Moving the palm of your hand into the middle of your chest, and now you're moving all the way over and into the armpit. Repeating this 4 or 5 times. Again, into the armpit to make sure you're keeping the traffic light green. And then we're here at this car. So at this point, you might find you still have enough movement here to slide over, or you might want to change hands and pull it over and then continue to push it there. Moving over there. And again, into the armpit, pressing up. Depending on how much space you've got between your nipple and your collarbone, you might do 2 rows of this, 1 high row and 1 lower row, or it might be that one hand's big enough, 1 row is fine just to go over. So you're repeating that above your nipple line, and then I'm just going to come backwards a little bit so you can see the next part of the sequence, where we're moving the fluid on the same side down to the groin. So right side's the affected breast, I'm going to move the fluid below the nipple line down here to the groin. So we start off in the groin. This is your traffic light down here. You're doing a few presses just on the line of where pants would normally sit, into the groin there, and then sliding your hand down, sort of 1 hand's height down towards your groin. 4 or 5 here, and then again just this slight scooping action in on that line. Moving your hand up and then sliding down towards the groin. Gently again over the skin, a little bit of pressure so you can feel the skin being moved, but not a really hard pressure, and into the groin. And then again, depending on your arm mobility and the width across your chest here, you might find that you want to use two hands, or you might find that it's easier just to do one hand. If you have somebody you'd like to recruit for this higher up bit, then you can do. And you're trying to just come down the side of the body, sweeping the fluid down, keeping this traffic light green at all times. And then once you've cleared down the side, you can think about moving from where your nipple line is or would be down the body here. So you're taking any fluid that's sitting here in this lower part of the breast or chest area down into the groin, and then from the inner side over, and again use two hands or a brush or a sponge or something if that feels better for you, over, and then just taking it slowly down and into the groin again. And then we finish the sequence with the same deep breathing that we did at the beginning.